I'm joining you today from Johannesburg, South Africa. I'm Nicola Christofides, and my colleague Ami Sengupta is going to join later on in the session. So the session is focusing on using research to understand the situation in order to develop a C4D program. So to start off with, when you think about the C4D planning cycle, you'll see that research is really critical at all stages in planning and implementing C4D programs. Most planning models start with some sort of analysis of the situation or diagnosis of the problem in order to really design a program or intervention that is tailored and targeted. So I'm going to show you a picture now of a very generic C4D planning cycle. It isn't the C process or the P process. It is one that uses concepts across that are common to many C4D planning processes. So in the beginning, you'll see that we start with understanding the issue or situation. And obviously, research is really critical there. We move on from there to focusing or designing our program. And during that, we need research as well, or we use research in order to focus our program. And when we get to the development and testing point, it's really important to use research to pre-test all materials or programs that you develop. And then throughout the implementation, you're going to be using research to monitor your program. And then finally, you would want to evaluate your program to know whether you are in fact achieving your objectives and making the change that you really want to make through your C4D intervention. So I'm going to talk a little bit about a situation analysis. And really a situation analysis is often what one of the tools that we use when we are wanting to understand the situation. And the important starting point is really to think about what we already know. And a desk review is really critical to that process. And once we know what we do know, then we also start to identify what we don't know. And those are the information gaps. So this is where we need to go and collect some primary research in order to fill those gaps and to really understand the situation and the audience very well. So in formative research for C4D, we have two critical things. The one is that we obviously need to define the focus of the C4D program. But through this, what is really important is how we decide what we're going to focus on and who will be part of that process. And that really is going to be the extent to which your research is participatory or not. So again, although you might have thought about participation in a different unit of this module, it's important to think about it, how you integrate that into your formative research as well. In your situation analysis, there are several things that you're going to be doing. So one would be to understand the problem better, what it is, why it exists, then also what has already been done. What are the C4D programs that have been evaluated and shown to be effective in bringing about change? You also want to know a little bit more about your participants or your audience. So who are they and what are their information needs? And then also understanding something about communication channels and media that is available in your context is really important, because it will provide information about how you might be thinking about delivering your C4D program. So in the beginning, you're going to start with your literature review. And the literature review really is about identifying what is already known about the socio-cultural context related to a particular practice. And your practice could be anything that UNICEF focuses on. So it could be on hand washing, or it could be on breastfeeding. And you then identify motivators and barriers to that practice. And it's really helpful here to learn what others have done to address the barriers or sociocultural context, and what factors have been shown to influence a particular behavior. And here I think that it can be really helpful also to understand and think about your setting. So what has worked in a setting that is similar to yours? Or, you might find some evidence that a program has worked in a setting that is very different from yours. And then you need to think and test out to see whether it would work in your setting as well. And you through this process of doing the literature review, you're going to be thinking about who are the participants, who's the audience who are going to be participating in your C4D program. And then lastly, as I mentioned before, you're going to be identifying gaps, what it is that you don't know in order to conduct research to fill those gaps. So when you are thinking about conducting research, this is the primary data collection, and you may be doing it yourself, or you may be identifying an organization, a research institute, or some consultants who are going to be working with you and to support the data collection. So some of the things that you might want to think about are things like, for example, conducting household surveys, doing qualitative interviews. So these can be in-depth interviews, key informant interviews, and focus group discussions. You could also do community mapping, which could be done in a very participatory way, and you could be using observational techniques. For your audience research, you really want to know how do the participants or the audience perceive and experience the C4D issue that you're focusing on? What are their beliefs, their perceptions, their attitudes? What are the social norms that exist in that particular community around the issue? Are there myths and misconceptions about the issue? What are the positive practices? Maybe there's some folks in a particular community who are really already practicing the desired behavior, like exclusive breastfeeding. Why are they doing it when others aren't? So finding out what is motivating them to do that practice can be really helpful in thinking about some of what you could leverage or what you could build on in terms of your program. And then also thinking about the barriers to a particular practice. In your primary data collection, you would be interested also in understanding what media the participants or audience use. So, for example, do people have access to cell phones? If they do, then that becomes perhaps a channel that you could consider using in your intervention. Or perhaps people listen to radio. So those are some of the channels that you might want to consider. What are the languages that people use in your particular setting? And there may be multiple languages, which you need to understand through your research process. So I'm going to hand over now to Ami, who is going to go into a case study of some research that we've been involved in Madagascar.
I'm going to join my colleague Nicola in this presentation on how you can use research to inform C4D strategies. She's already discussed and how you start with a literature review and what are some primary data collection tools. Now, what I'm going to do is I'm going to take this a little further and see how we actually do this in a practical situation. So I'm going to share with you a case study in Madagascar. A group of us were working together as a team of consultants, and we were tasked by UNICEF Madagascar to help them conduct a study to understand the socio-cultural determinants to adopting key family practices. So this was a whole set of 12 family practices, including child survival, nutrition, education, child protection, sanitation. So pretty much all the practices that determine the health and well-being of a child. So what our task was to understand why people practice certain behaviors, or in other situations do not practice certain behaviors. So it's quite a broad study, including a lot of behaviors, and we're working closely with a national partner, the University of Antananarivo. But I'm just going to give an example of the child protection practices, because I don't want to go into detail into all 12. So the behaviors that the C4D strategy is trying to promote, or the practices that they're trying to make parents and caretakers of children do, were two for child protection. One was that they were going to delay early marriage or child marriage. So essentially not agree to marrying their children before they were 18. The second practice was that they were going to promote non-violent behaviors. So this is nonviolent discipline, but also look at the protection and protection of children and prevent all forms of violence, abuse, and exploitation. So what we began with doing was we started with a literature review. And the purpose of this literature review was to really scope the scene and see what is available, what information is already out there, and what we already know. Just like the situation analysis is the first step in a C4D planning process, and we tried to understand the context better. The purpose of doing this was to understand, one, what is available in terms of information and data, but also to understand and identify the data gaps and figure out what we don't know. So the process of the literature review, we began with looking at existing surveys and national data, large-scale data. And then we also looked at the qualitative and anthropological data that was available, because it's really important to understand the sociocultural context and why people do or don't do certain things. Then we also looked at all the published research. So like Nicola mentioned, we need to know what may work in Madagascar in that context. So we need to look at studies that were conducted in Madagascar on related issues. But if there is good practice or there are lessons learned from other contexts and other countries, we need on the same issues, we need to have a look at that. For instance, child marriage. There's a wealth of information available in other settings. So it's important to review that too and see if those ideas or those strategies can work in the context of Madagascar. Then finally, what we did is, so we had the survey data, we had the qualitative data, and then we had information that was available from published reports and peer-reviewed journals. So what we needed to do was summarize the information and figure out, sort of categorize and synthesize what we know and what's available. And then the next step was to identify the areas for required additional research where there wasn't enough information. We had established a set of guiding questions, and given that the focus was on C4D, so we wanted to know as much as we could about these family practices nationally, and the focus of the intervention was going to be in 3 selected regions. So we wanted to know how are the 3 regions different from the rest of the country. We wanted to know people's knowledge, attitudes, and behaviors as they related to these 12 practices. We wanted to know the barriers and motivators adoption of these practices. So why are people following certain practices, and what impedes people from following certain practices? Again, because this was C4D, it was very, very important for us to understand communication practices and influences. So basically, who is talking to whom? Who do people trust? What are the trusted sources of information on health? What are the trusted sources of information on child protection? What are the communication networks in communities? Who are the decision makers? So these are some of the things that we needed to find out. Once again, the social norms and cultural beliefs were very, very important, not just for the child protection behaviors, but even for something like maternal nutrition or the taboos that people have surrounding what pregnant women and lactating mothers can eat or cannot eat. Then again, going back to the communication focus, we needed to know people's access and use of media and information and communication technology. So these were some of the questions that we set out to find out. Then in terms of C4D determinants, we kind of clustered them broadly into 5 broad issues. And we said we need, to understand why people are practicing or not practicing certain behaviors. The determinants are basically the knowledge and awareness level. How much do they know about certain issues? What are their beliefs and perceptions and attitudes about those issues? What are the cultural traditions? Then again, as I mentioned, the key influentials and the people that influence other people's decisions to adopt or not adopt certain practices. Then we had to look into the communication networks and really understand who's talking to whom and what are the communication networks that exist within communities. So once we had all this information, we synthesized it into 3 broad categories. We had the prevalence data and trends, and then we clustered all the qualitative information into the determinants, and then we went on to see what are the gaps and what are the future directions for research. So what don't we have any information on, and what research questions do we need to ask? So just to give you an example of the prevalence data and the trends that in the case of child marriage, this really gave us a clear sense of the extent or the severity of the issue. Our literature review showed that child marriage is very prevalent in Madagascar, with close to half of the female population married before the age of 18. In terms of trends, the data showed that the number was higher in the south. It's close to 65% of the girls were married before 18. Much smaller percentage of the female population were married before the age of 15. So it was only about 12%. So we know that majority of the marriages are happening between 15 and 18. We also know that early marriage is very closely linked with teenage pregnancies, maternal mortality and morbidity, low birth weight. And we also, the data also showed that the men tend to marry much later than the females. So, in most cases, it was the girls who were marrying before 18. This gave us a very clear sense of the issue and, the extent of it. In terms of the determinants, the qualitative data showed that in most cases, it was arranged by parents and at a very, very early age. This was something that was endorsed widely by community leaders. It was also an interesting thing that, the data revealed, which was that the parents control or decide the future of girls. Early marriage was also a way of preserving economic ties and kinship ties and, keeping the wealth or the cattle in the community and in the village. So, some of the gaps that emerged from our literature review, that we did have, national data on the extent of child marriage, but the term child marriage had many, many meanings in communities, and there were marriages that were civil marriages and legal marriages, but there were also traditional marriages, and they may not be registered. There were also few instances of forced marriage. So we didn't have a very nuanced information on all the different types of marriage that occurred in communities. We also had no information on the link between child marriage and sexual abuse. We also didn't know how people perceived the link or the relationship between early marriage and maternal health and well-being, or teenage pregnancy. And what we didn't know, another critical area we realized there was a gap of information was that we didn't know the knowledge levels and the information needs of teenage mothers. Those were the gaps, and I hope this case study gives you a sense of how we go about doing a situation assessment. How we do a literature review, most importantly, how do we synthesize the information? Because when you start on any kind of a review, you'll be overwhelmed with how much information there is. So it's really important to kind of streamline and say, what do we really need to know in terms of designing a C4D strategy?
So in conclusion, I just want to really acknowledge the fact that as program officers, you may very well be very experienced in doing research. And that what we were talking through was really about how do you think about some of these concepts in connection to C4D. And so I hope that this has been a useful session for you. I really also want to say that this is just a brief input and needs to be viewed in conjunction with the readings that you have.